You're watching TVC Breakfast. The coronavirus is sweeping across countries with far-reaching effects on economies and people's way of life. The respiratory illness is not selective. It affects people of all races, age and gender, but there is proof that some category of people remain at a greater risk. In response to the outbreak, some extreme measures have been put in place, such as lockdowns, a ban on gatherings, social distancing, regular hand washing, sanitizing, and general practice of good hygiene. Because of our way of life in this part of the world, abiding by these regulations that could reduce exposure and check spread of the COVID-19 infection has not been easy for people. Today, our focus is on persons living with disability, the impact of the pandemic on their lives, their susceptibility, and coping mechanisms at this time. Well, joining me via Skype is an experienced disability policy and legislative advocate. He's also the Executive Director, Center for Citizens with Disabilities, David Healy. Good morning. Thank you for joining us on TVC Breakfast.
Good morning, Veronica.
All right. When the disability was signed into law, a lot of persons thought that anything that has to do with persons living with disability will always take center stage, especially at times like this. But that doesn't seem to be happening at this time. How concerning is this for you?
This is a serious concern to more than 25 million Nigerians living with disabilities, with 80% in rural areas with minimal access to social infrastructure. Appreciating that the President, in his wisdom, last year, January 17, 2019, signed the disability bill into an act which provides that in a state of emergency, that persons with disabilities will be given priority. We are worried that palliative measures designed by federal government of Nigeria is not reaching to people with disabilities. A classical example is what happened yesterday in Kwali, Abuja, FCT, where the Ministry of Humanitarian Affairs, Disaster Management and Social Development gave out, palliative measures in terms of cash. From what we watch from the TV, nobody with disability was seen accessing the support given by federal government of Nigeria. And that shows that disability issues or person with disability is yet to be a priority before the federal government of Nigeria. It is worrisome.
Now, how do you intend to go about making your voices heard, because you represent this section of society? How do you intend to push at this time? Because it seems the government has an array of issues it has to deal with.
What we are doing is creating awareness, talking to those we could talk to that is in government, talking to those who have access to those who are in government, using this media to draw the attention of the Honorable Minister, Minister Farouk, that the services she's rendering to Nigerians are not accessible to Nigerians with disabilities. They mentioned that they have a social register, and this social register, we are concerned that a social register that contains list of vulnerable people is not inclusive of people with disability. We are really worried, including the response of the Presidential Task Force on COVID-19. Their approaches and their services, we are worried that it's not accessible to people with disabilities. As we are speaking, the task force is here to tell us how many people with disabilities have shown positive to this virus. This will enable tracking, enable addressing specific issues of critical concern to people with disabilities. We're not just talking about one cluster of disability. We are talking about the blind, the deaf, the physically challenged, the spinal cord injured, people with intellectual disabilities, among others. Therefore, state response to these palliative measures, to this pandemic, must be seen to be inclusive, in particular, Nigerians with disabilities, recognizing that they are the most vulnerable of the vulnerable social groups. They cannot speak, many of them. They cannot walk, many of them. As such, every effort must be made by the federal government as well as the state government to ensure that they are not left behind. Look at here in Lagos State. We have Lagos State Office for Disability Affairs. As I speak to you, the governor of Lagos State is yet to set up the board of the Lagos State Office for Disability Affairs, which makes it difficult for that office to coordinate activities that will support people with disabilities in Lagos State. In Abuja, the federal government is here to establish the National Commission for Persons with Disabilities. What that means also is that effort to coordinate issues of people with disabilities in the country will be undermined. And that is why we are really worried. We are calling on all Nigerians, especially those that have access to the president, those that have access to the Minister for Humanitarian Affairs, Disaster Management and Social Development, to speak to her, to speak to the president in particular on the plight of Nigerians with disabilities, that the palliative measure he has put in place is not reaching to people with disabilities.
All
that
right.
is our situation.
Now, if I may interrupt your line of thoughts now, when information came out about those who are susceptible to the COVID-19, nothing seems really mentioned about those living with disabilities. By way of education, talk to us about how susceptible people living with disabilities are to the coronavirus.
Recognizing that an average person with disabilities depend on caregivers for services. An average person with disabilities uses assistive device. An average person with disability in order to move around. Without measures put in place to ensure that they are protected in this period of containment of this pandemic, it will be difficult for them to avoid contacting this virus. We are worried that state response around containment, around measures to ensure reduction of the spread, is not targeting people with disabilities. Take, for instance, at the PTF, it took time for PTF to bring in a sign language interpreter. And the sign language interpreter that is being used by PTF is being donated by a non-profit organization. This is shameful.
All right, David Anyele, let's leave the discussion at this point. Thank you for speaking with us. Well, joining me via Skype is an experienced disability policy and legislative advocate. He is also the Executive Director, Center for Citizens with Disabilities, David Anyele. Good morning. Thank you for joining us on TVC Breakfast.
Good morning, Veronica.
Now, one of the measures has been that is being, championed across the globe is social distancing, self-isolation. Now, talk to us, and we know rather that a lot of persons living with disability rely heavily on assistance from persons around them. Now, how challenging has this been, especially how this is, talk to us about how this is changing lifestyles of persons living with disabilities.
Yeah, the social distance mechanism that is recommended by World Health Organization and other health experts is one of the most difficult measures for people with disabilities. The reason is simple. An average person with disabilities depends on one person or the other to get support. Especially here in Nigeria, where there is no social support directed at people with disabilities that will help them to manage their affairs independently. As such, recommending social distance for a person with disability is more or less recommending him to disaster. As such, people with disabilities in Nigeria are crying and screaming on how government will come to their aid. The problem we have is that when government is making this kind of policy statements or implementing this kind of policy, they hardly consider how it will affect people with disabilities. An average blind person must lean on one person or the other to move around, even to go to toilet. An average person on wheelchair depends on somebody even to move around within his environment. As such, asking such person for social distance is not applicable. Therefore, we are asking that government should go extra mile to identify measures to ameliorate the impact of this pandemic on people with disabilities in Nigeria. A situation whereby palliative measures are being implemented by the government, as we saw yesterday in Abuja, and nobody with disability was found among beneficiaries, is disheartening. We are asking the Minister for Humanitarian Affairs, Disaster Management and Social Development to take appropriate measure to ensure that her relief packages target people with disabilities. Unfortunately, many of them may not come to that kind of crowded places. That is why it's important that a data capturing measure should be put in place to identify people with disabilities across the federation, so as to ensure that they are not left behind in this difficult situation we find ourselves. We are also asking, yes, ma'am.
Go ahead, go ahead.
We are also asking the federal government of Nigeria that support the people with disabilities will be made easier by establishing the National Commission for Persons with Disability. Assuming this National Commission is in place, it would have been more easier to advise the government on what to do and how to do it. Unfortunately, this is 15 months. President Muhammad Buhari signed the National Disability Act. Unfortunately, they are yet to implement it. The same thing is applicable here in Lagos State. Governor Sanwo-Olu is yet to constitute the board of LASODA, Lagos State Office of Disability Affairs. Lagos State Office of Disability Affairs is responsible for coordinating disability issues in the state. Regrettably, even the State Ministry of Agriculture Food Support Program they are conducting currently.
I'll have to interrupt your thoughts now, because I am wondering, the essence for social distancing is to curtail the spread of the coronavirus. You have been following developments with regards to how this is spreading and how cases are rising across the globe. What will be the measure government can put in place to ensure that persons with disabilities are protected? Because the essence of this is for everyone to be protected, don't you think?
It is important. What the government should do first is to make a public announcement around people with disabilities across Nigeria, asking the local government workers to identify them wherever they may be across the wards, so as to extend relief materials to them. It is not a rocket science. Every Nigeria belongs to one ward or the other in this country, and every ward is linked to a local government. Therefore, if federal government is sincere in targeting people with disability, they should contact people with disabilities in all the wards in Nigeria, so as to ensure that relief materials are taken to them, to avoid them coming out to look for what to eat from their neighbors, thereby, interfacing with people unnecessarily at this difficult period.
All right, David Healy, thank you so much for speaking with us.